show a video of circumcision, and I apologize up front if anyone has a weak stomach. I'll tell you right at the beginning, it's pretty disturbing, it's very graphic, and it's also very necessary, because everybody likes to eat their steak, but nobody likes to go to the slaughterhouse, right, and actually see what happens in the slaughterhouse. So I think that if anyone ever asks me, should I circumcise my child, the best response I can ever give is just go watch one, okay? Go watch one. While you're watching this video, I want you to imagine that circumcision never existed, okay? It was never invented in Egypt, and I came in here with this on my computer, and this is the first circumcision anyone's ever seen. Okay, it's the first time anyone's seen a child pinned down and have part of their penis cut off. You would arrest me for having this on my computer. Okay, it's a gross violation of the child's bodily autonomy, and also I want you to listen to the monotone, detached voice of the physician who's performing the procedure. It's another day at the office for the physician. This is a gonco plant. It actually crushes off the foreskin. So the bell protects the head of the penis, the glands. You pull the foreskin up around the bell, and it's like a vice. So it's going to come down, it's going to crush off the foreskin, and it's also going to achieve hemostasis to go leave it on for about 5 minutes or so after the circumcision. That's the brown scar that I showed you on the previous picture. That's from this gonco plant. So you can see the foreskin being pulled up now, and then just crank it like a vice, and crush it off. That's what he's doing now. He's starting to tear. So that's the usual part of the talk where I have 100% of the audience attention. So I'll ask you this question: why are we doing this? Like, you see this, you see the severity of what's happening. I've talked about the sexual function of the foreskin, so there must be a really good medical reason, right? There must be enormous medical benefits that we can bestow on children by doing this procedure when they're infants, and that's what you would think logically. But the actual reason why it's part of modern medicine now is it's a very disgraceful and embarrassing chapter in the history of our profession as doctors. And we have to go back to the Victorian era. So the Victorian era was, Darwin had just published Origin of Species. The authority of the church was sort of dwindling. People were really wondering, is there a supernatural realm? Is there a metaphysical realm? Nervousness, ESP, all these Ouija board type of parties. People were obsessed with trying to establish a connection to the supernatural realm. And medicine during that time was always trying to establish a psychosocial, a nervous, excitatory reason for all these diseases that were plaguing us. So for instance, diabetes was considered a nervous disorder, and and it was treated as a nervous disorder. So there was this, Victorian physicians were convinced that overexcitation caused a lot of health problems in children. And the worst type of nervous excitation was sexual excitation. And the Victorian physicians considered masturbation as a feedback loop. It sort of exacerbated this sexual excitation, this sexual energy. So they considered masturbation as the cause of a number of illnesses. It caused psychological illnesses, it caused physical illnesses, arthritis, bedwetting, autism. All of these problems were attributed to masturbation. You know, masturbation was the smoking of the Victorian era. Anything to decrease masturbation would help. And I always say, you know, it's not like smoking, because if it was, then I would have developed emphysema when I was in grade 9, but that was the perception, okay? So masturbation is the reason why they introduced circumcision into Western medicine as a means of controlling masturbation. And one of the biggest proponents of circumcision was J. Harvey Kellogg. J. Harvey Kellogg was the inventor of Kellogg's Corn Flakes. He was a big colon enema advocate. He thought that giving kids enemas was always the cure for things. And he was convinced that masturbation was causing all kinds of health problems. So he developed these anti-masturbation devices, but he was a huge proponent of circumcision, and he wrote a lot about it. And I'm just going to read you a quote from his book that he published in 1888. It's called Treatment of Self-Abuse and Its Effect. He says, he's talking about masturbation, and he says, a remedy which is almost always successful in small boys is circumcision. The operation should be performed by a surgeon, but without administering an anesthetic. The pain attending the operation will have a salutary effect upon the mind, especially if it's connected with the idea of shame and punishment and loss of sexual pleasure. The soreness, which will persist for weeks and sometimes months, interrupts the practice, and it may be forgotten. 2 pages later, he talks about masturbation in female children. He says, in female children, this author has found the application of pure carbolic acid to the clitoris an excellent means of allaying the abnormal excitement that causes masturbation. So this is a well-respected, this is a superstar physician of his day, promoting circumcision as a way of decreasing masturbation, by decreasing sexual pleasure, and also by disrupting the gliding mechanism that made masturbation easier for children. So that's how it started, and then as it went out of fashion, physicians started finding all kinds of other possible reasons why it may help children. And they started proposing these ridiculous health benefits and published them in very, very well-respected medical journals. And I'm just going to blast through a few of them. If you think I'm lying, every single journal article here is referenced, okay? 1845, Edward Dixon declares circumcision cures masturbation. 1855, Jonathan Hutchison claims circumcision prevents syphilis. 1865, Nathaniel Heckford claims circumcision cures epilepsy. 1870, Louis Sayre claims circumcision prevents spinal paralysis. 1871, M. Moses declares circumcised Jews are immune from masturbation. 1873, Joseph Bell claims circumcision cures bedwetting. 1875, Louis Sayre declares the foreskin causes scoliosis, paralysis of the bladder, and clubfoot. 1875, H. Kane claims circumcision cures wet dreams and abdominal neuralgia. 1881, Maximilian Landsberg claims circumcision cures all eye problems, all eye problems. 1890, William Gentry claims circumcision cures blindness, deafness, and dumbness. 1891, Jonathan Hutchison declares the foreskin constitutes a harbor for filth, is a constant source of irritation, conduces to masturbation, and creates difficulties for sexual continence. 1894, P. Romandino claims circumcising blacks prevents them from raping white women. It's right here if you want to pull out the medical journal. These are respected medical journals. 1894, H. Rosenberry claims circumcision cures rectal incontinence. 1901, Ernest Mark recommends circumcision as a method to permanently desensitize the penis and promote chastity. 1914, Abraham Wolfbars demands compulsory circumcision of all non-Jewish children. 1914, he says it cures tuberculosis. 1926, it prevents penile cancer, prostate cancer, venereal disease, cancer of the tongue, cervical cancer. 1949, okay, an English physician named
Douglas Gardner. He conducts a careful review of all existing medical literature, including every study that's been published about circumcision, and he concludes that there's no medical justification for infant circumcision. Okay? Circumcision rates in Europe, the UK, pretty well everywhere except North America start to decline instantly after that paper is published. So, what about the Canadian Pediatric Society? Well, this is the official position statement from 1996. It says, after reviewing the scientific evidence for and against circumcision, the CPS does not recommend routine circumcision for newborn boys. Many pediatricians in Canada no longer perform circumcisions. My position statement would have been this. It's the most brutal fucking thing you've ever seen. Now, I can show you horrible complications. I can show you complications all night of children who lost their penises. I can talk about the thousands upon thousands upon thousands of children who died from circumcision. Okay? The more children die from circumcision every year in the US than sudden infant death syndrome. I can go on and on about this, but the truth of the matter is now, with the sophistication in the surgical techniques, it's a relatively safe procedure. With a complication rate of about 1.5%. So there's not a lot of complications that come out of this, other than the loss of sexual function and other stuff that we've talked about. There are a few complications that people don't know about, though. This is an adhesion. Okay, so this is after the part of the penis has been cut off, two parts stick together that aren't meant to stay together. This is actually fairly common. Most circumcised males don't recognize this as abnormal anatomy, but this should not happen, and it's relatively common. One of the other circumcision complications is called meatal stenosis. This occurs exclusively in circumcised children, and it's because of the meatus, the opening of the penis is exposed to urine and to feces. It becomes irritated and it can cause narrowing in that opening, which can make urination difficult afterwards. So there's some subtle complications that are very common that are sort of unrecognized that go. And of course, there's very dramatic things. This was an infection that led to a complete thrombosis of the corpus cavernosum. This child lost his penis. Devastating complications will still occur. 1 million circumcisions are performed every year in the United States. One of those kids is going to die. 2 of those kids are going to lose their penis. Horrible things are going to happen. And the thing is, it's completely unnecessary. It's completely preventable. It's unnecessary surgery that kids are being inflicted with. Now, I'm a physician, so I'm here to talk about the medical side of this with you. So I find it's not useful to cherry pick literature that shows no medical benefit to this, because people can also cherry pick literature that shows a benefit to it. So the way I like to approach the medical benefits is I like to argue, let's assume that circumcision proponents are right. Okay, let's assume that all the medical benefits that they propose are in fact true and valid. Okay, you can significantly prevent diseases. Let's take it from that approach. Okay, so we'll start off with penile carcinoma. If circumcision is 100% effective at preventing penile cancer, which it's not, okay, because circumcised men develop penile cancer, but let's assume that it is. Say it's 100% effective. Okay, the incidence of penile cancer is 1 in 250,000. So if it's 100% effective, you would have to perform 250,000 circumcisions to prevent 1 case of penile cancer. 249,999 unnecessary genital cutting surgeries to prevent 1 case of penile cancer. The average age of onset of penile cancer is 76 years. Okay? So you're going to prevent 1 case of penile cancer in a 76-year-old by performing 250,000 circumcisions. If a circumcision costs $300, that is $75 million of medical costs to prevent 1 case of penile cancer. So there is no other area in medicine that we use this type of proportionality, this type of rationale. There's nowhere else in medicine where we cut off normal anatomy because it may develop a medical problem later. We don't take out appendixes, and they run into problems a lot. We don't remove breast buds. 1 in 9 women will develop breast cancer, and half of those women die from breast cancer. We don't remove breast tissue. We let pathology develop. When there's pathology, when there's medical urgency, then we operate. Okay? We don't prophylactically operate. You are more likely as a male to die from breast cancer than you are from penile cancer. You're more likely to die from lightning hitting you than penile cancer. Let's take human papillomavirus. Okay? We have a vaccine now to the human papillomavirus. This is commonly argued. It prevents lower rates of HPV infection if you perform a circumcision. We
have a vaccine for this virus. It's not an issue, it's not an argument anymore. The studies that were done in the 70s, actually, where they showed higher rates of HPV infection in women who had intact male partners. When they went back and they examined the strains of those viruses, they were different. So there was either the milkman involved, or the HPV was contracted before she had that sexual partner. So the evidence is very conflicting there, but it's an argument that we should have had 20 years ago, not now. Cervical cancer falls into the same garbage can because it's HPV that's been associated with the development of cervical cancer, and the vaccine will significantly reduce the rates of cervical cancer as we go forward. Urinary tract infections is the one medical benefit that I will concede. There's probably a very small benefit in terms of circumcised penis not developing the urinary tract infections. And one of the reasons is because there's a hostile flora of bacteria that live in that meatus. I told you that meatus is exposed, right? So we get bacteria that grow in there that's very hostile and basically kills the other bacteria that causes urinary tract infections. So there probably is a very small protective effect for urinary tract infections. What is the incidence of urinary tract infections in male infants? It's 1 in 186. So you'll have to perform, if it's 100% effective, let's not forget. You'll have to perform 186 circumcisions to prevent one case of a urinary tract infection. The cost is $60,000 to prevent one urinary tract infection that you can cure with $12 of antibiotics. Recurrent urinary tract infections, the incidence is 1 in 1,577. So you have to perform 1,577 circumcisions to prevent one recurrent urinary tract infection. That's $437,000 that you could cure it with 2 doses of $12 in antibiotics. Okay, so the balance here is insane. And people can argue these medical benefits all they want. They can present the studies. I will just ask you, when you read the next study, just think of Sweden. Okay? Sweden beats the United States on every measurable parameter of sexual health. Every venereal disease, HIV, herpes, gonorrhea, chlamydia. Sweden beats the U.S. on every measurable parameter of sexual health. And that's a country with about 1% of the population is circumcised, where the U.S., 80% of the population is circumcised. So if there's a protective effect, it is greatly overshadowed by behavior, lifestyle choices, and sexual education and sophistication, I would argue. Now, what about HIV? So this is a new thorn in the side of intactivists, for sure, over the last 3 years. Those of you who are unfamiliar, there have been 3 relatively large randomized control trials out of Africa, sub-Saharan Africa. And these control trials have shown a protective effect of circumcision from preventing transmission of HIV from a female to a male living in those parts of the world. And before we get too far into HIV, because it's worth about 5 minutes, I'd say, we have to just go back and recount all of the medical reasons why circumcision has been promoted. So in the Victorian era, it was nervous diseases, psychoses, irritability, seizures. Circumcision was promoted during that time to prevent those diseases. Late 1800s, it was musculoskeletal diseases, scoliosis, dysplasias of the hips, synovitis, arthritis, and circumcision was promoted for those ailments. World War I and World War II was venereal disease. Okay, venereal disease, GIs were returning from the wars, that was on everyone's mind. Circumcision was promoted for venereal disease. In the 60s and 70s, antimicrobials were very good. Infectious disease wasn't such a big problem. What was on everybody's mind? Cancer, 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 cancer. Cancer of the penis, cancer of the bladder, cancer of the rectum, cancer of the prostate. Circumcision has been promoted for all of those things. 80s and 90s, what's the big medical problem that faces medicine and researchers right now? HIV/AIDS. Circumcision is the cure, right? Circumcision is the cure, just trying to find that disease. So these authors that publish these studies are Western circumcision proponents, one from the US, one from Canada, one from France. And these are not infectious disease experts. These are Western circumcision proponents. Auvert has been a circumcision proponent since 1994, Bailey since 1998, and Gray since 2002. All of these authors combined, before the African trials, have published 140 scientific articles promoting circumcision as a health measure. So So the 140 journal articles before they got to HIV in Africa specifically promoting circumcision as a health benefit. So you hear in the media, it decreases your chances of contracting HIV by 50%, right? So the trials, the methodology of the trial, they were big studies. Half of the men, they performed the circumcision. Half of the men they left intact. And they just left them for 2 years. And at the end of the 2 years, they tested them for HIV. And these were the numbers that they found. So in South Africa, the intact group, 45 infections. Circumcised group, only 20 infections. Okay, that's not bad. That's half as many. 50% reduction, 50% relative risk reduction. The numbers were pretty similar in the other countries as well. You see 50 to 60% on every article published in the news about the protective effect against HIV. What is the absolute risk reduction? Well, 45 out of 1,582, that's 2.84%. And 20 out of 1,500, that's 1.29%. So the absolute risk reduction is 1.5%. So circumcising 1,546 men had an absolute risk reduction of 1.5%. Okay? Don't hear that number too often. Point number two, the authors of these studies concede themselves that circumcision is not the answer because 20 people got HIV here, 22 here, 22. Those are very high rates of HIV. Those are thousands of times more common than we see in our own society for developing HIV, those rates. So the authors concede that circumcision has to be performed with other safe sex strategies, including using condoms every time you have sex. So, translation, you can either stay intact and use a condom every time you have sex, or cut off the most heavily innervated part of your penis and use a condom every time you have sex. That's what their recommendation was from these studies. The flaws in the methodology. Now, they started the clock times 0, and then they circumcised the intervention group. So the circumcised men had to wait for 6 to 8 weeks before they could have sex. So there was a lead time bias. There was almost 2 months before they could actually start having sex. Okay? Most of the protective effect occurred early in the studies. So most of the HIV infections in the intact group occurred right at the beginning. So they didn't correct for that lead time bias. Okay? They didn't control for the percentage of female sex workers in the counties where these men live. That is the biggest risk factor for a male contracting HIV from a female is the percentage of female sex workers in their county. They didn't control for concomitant malarial infection. Malaria greatly increases HIV viral load in the bloodstream. Okay? They did not control for that. The attrition rate, the dropout rate in these studies was almost 8%. So 8% of the study population dropped out. Okay? The biggest sin, I think, from these trials is after 2 years, after 24 months, after the trial was stopped, what did they do? They circumcised the control group. They said, well, here you go, 50% reduction, who wants to be circumcised? They took the evidence and swept it under the carpet after the trial had finished. They could have followed these men for another 5 years, 10 years, with the rates even out. Okay. After 2 years, they circumcised the control group. So there's no more, that cohort is now extinguished, we can't follow them anymore. Okay. Those were some of the flaws with the study. What about other studies? Well, what do larger demographic trends tell us about HIV and circumcision? Okay. UNAIDS published a paper in 2008 in Africa which showed that 8 out of 13 countries in Africa, 8 out of those 13 countries have higher rates of HIV in circumcised men than they do in intact men in Africa. The Xhosa tribe in South Africa is a 100% circumcising tribe. The Zulu tribe in South Africa is a 100% intact tribe. The HIV rates are identical in those two tribes. In the United States of America, there is no difference in HIV infection among homosexual men between circumcised homosexual men and intact homosexual men. Heterotopic couples living in North America, where the woman is HIV positive and the man is HIV negative, if you look at the transmission rates, the circumcision status of the man is irrelevant. If you compare the United States to Scandinavia, the United States has 80% population circumcised, Scandinavia is less 1% or less. The United States has a 6 times higher HIV infection rate than Sweden, and it has an 11 times higher HIV infection rate than Finland. Okay, so You could say that the circumcision experiment has been running for 2 decades in the US, and it has failed. There's graves all over the United States that contain circumcised men who died of AIDS. And if you know that a future sexual partner is HIV positive and you're circumcised, are you going to wear a condom or not? Of course you're going to wear a condom. It's the larger demographic trends do not support this as an effective measure. As a measure, this has been rejected by the medical associations of New Zealand, Australia, Denmark, Sweden, Finland, most of Europe, and South Africa itself. The South African Pediatric Association rejects circumcision as an intervention for preventing HIV, certainly in children. Okay? Most medical organizations would recommend continuation of ABC, abstinence, be faithful, and condom use, anti-malarial drugs, because again that decreases the HIV load, and cheap antiretroviral drugs to help treat the HIV infection. The moral bankruptcy of trying to export this practice to the world's poorest and least educated people so that you can justify doing it back at home is a horrible thing. And I'm ashamed as a Western physician to even be associated with that. So what do we see in Africa? Well, we see billboards like this now. I'm proud I have a circumcised husband because we have less chances of getting HIV. So in Africa now, in these countries, it's become a sign of scientific sophistication, being Western, right? Being like an American, being circumcised, right? The science is there. People who are in the know get circumcised. You can be in a club in Uganda, and the DJ will be spinning music, and in between songs, he'll say, "Hey, ladies out there, who likes circumcised penises?" And everyone goes, "Woo!" like that. And then he says, "All you brothers out there, if you want to get lucky tonight, you get yourselves circumcised. And circumcision prevents HIV." This is the culture now. The culture believes that circumcision is a sign of American sophistication. You can be in Kenya, and someone can knock on your door, and it's the door-to-door circumcision campaign, where they will come into your house, and the public health nurse will show you these 3 randomized control trials, and then the surgeon will circumcise you on your couch or on your dining room table, if you like. And they go from door to door, and they do it at nighttime so that the neighbors can't see who is and who is not accepting them into their house to get circumcised. You can be in Zimbabwe, where there's summer camps where you can send your 10 to 15-year-old to summer camp and they get circumcised at the 3rd day of camp. Recently in Zimbabwe, there was 2 13-year-olds who abducted a child from their school who was 8 years old, who was from a non-circumcising tribe, and they tried to circumcise him, and they almost killed him because they thought it was disgusting that he wasn't getting circumcised in the school-promoted campaign. This is morally atrocious. It's American imperialism that's being inflicted on these very vulnerable and very uneducated parts of the world. Now, back to our own country, the circumcision industry in North America. So, yes, you can make money doing circumcisions. There's a saying, you know, a baby boy is born with a $300 bill wrapped around his penis. And there's physicians like Neil Pollock in Vancouver, his website says he's performed 10,000 circumcisions. That's $3 million in circumcision profit. I think it's very naive to believe that it's primarily economic motivation that fuels this practice in North America. There's a very complex set of psychological motivations at work here. And what you see, though, is a common trend that most practitioners who promote circumcision are themselves circumcised. You don't see many Swedish researchers or Japanese researchers publishing things. You don't see Japanese physicians recommending this to parents. It's circumcised physicians. Little baby boys grow up, and some of them become doctors, and some of them become urologists, and some of them recommend circumcision. And this is a study from Saskatchewan. It was a questionnaire-based study given to Canadian family doctors. And it was basically asking them, do they recommend circumcision to parents or do they not? And of the and they asked them all kinds of other personal things about their sexual orientation, their circumcision status. And 80% of the responders said that their recommendation is based on medical evidence alone, whether they recommend it or they don't recommend it. So 80% of the physicians said they base that recommendation on medical evidence. 75% of the circumcised physicians recommend circumcision, and 75% of the intact physicians recommend against circumcision. So you can see the cultural transference there, right? it's circumcised physicians are drinking Kool-Aid too. They believe that it's healthier, that it's more hygienic, that it's aesthetically more pleasing, all the hygiene issues. So it's predominantly a memeplex that circulates through circumcised physicians. Next, to deal with, there's probably some very difficult psychological issues to do what I just showed you in that video. And I think that one of the ways that practitioners compensate for that is they develop this sense of empathy towards the child. They almost share in the child's misery. They say, like it's almost altruistic the way that they share in the pain of the child. You know, I don't like doing them, because I don't feel good about doing them, but I do a good job and I give them proper pain control and I do it safely, and they're going to go somewhere else and it's going to get done. So the physicians kind of rationalize it. They almost take on the empathy. They commiserate with the child's suffering. One of the biggest problems is the consent process. This woman's just been in labor for 15 hours, and then they have to consent about something they may not have thought about ahead of time. And the consent process, it's flawed. The physicians may not, they don't mention any of the functions of the foreskin. They downplay the possible complications or side effects. They upplay the cultural and social importance of it, the importance of looking like other kids in the locker room, looking like dad. So we, as physicians, we are not cultural brokers. We're not scalpel jockeys to make kids look the way parents think they should look. That's unethical medicine. Physicians are responsible to our patient, and our patient is the child. So without medical urgency or without significant medical benefit, we have no right violating their bodily autonomy. We have no right performing an unnecessary surgery on them at all. These are the UNESCO published a list of fundamental pillars of medical ethics, and these are the 5. Primum non nocere violates that. You saw the video. First, do no harm. Well, that's harm in my opinion. Beneficence, it's unethical to provide invasive surgeries without a clear medical benefit. Circumcision violates that. Autonomy. You may cut part of your penis off if you choose. Okay? You may not cut part of my penis off because I did not choose. That's a very basic issue. We get consent forms for everything we do in a hospital, except this. Okay? The child is the patient. The child cannot consent. Therefore, you should not perform the surgery that they may or may not have wanted. Justice. It is actually illegal to perform. It's illegal to remove body parts from your children without medical justification and without medical urgency. So you can't just bring your child into the physician and say, cut off his 5th toe. Okay? Just think about this. If it was your adult son and you just showed up at their house one day and circumcised them, I mean, that's assault, right? So everyone can realize that when the child is autonomous and they're an adult, you shouldn't do it. But when they're a baby and they can't fight back and they can't make decisions, then it's okay. So that's a problem. It violates the principle of justice, and it violates the principle of proportionality. Okay? Proportionality means if you have a wart on your finger, there's a 100% success rate for curing that wart by cutting off the finger. Okay? But it violates the ethical principle of proportionality. You're using a sledgehammer to kill a fly. Okay? You don't need to be so invasive. You should be doing less invasive maneuvers first before amputation of tissue. Circumcision and human rights. I'll just speed up, but basically the tools already exist in international law to ban circumcision. This is the Convention on the Rights of the Child. It's from 1989 from the United Nations. It was the foundation for banning female circumcision worldwide in 1996. And it basically says that the child has the right to life and bodily integrity. No child shall be subject to torture, cruel, inhumane, or degrading treatment. No child shall be subject to sexual exploitation, sexual abuse, and sexual torture. And no child shall be subject to traditional practice prejudicial to the health of the child. So all the tools are already there in international law. This is what they applied to the female circumcision. It just hasn't been applied to male circumcision yet. I'll skip that because we want to have a discussion now. This is the part that probably will interest you folks the most, is circumcision and religious freedom. So again, we have religious and superstitious beliefs to thank for this practice in the first place, right? It was the priests in Egypt that dreamt this stuff up. And it's a terrible liability of the religious mindset that it can give you divine command to commit a horrible action. Okay? You're given a divine instruction to do something morally atrocious. And this is something that, as secularists, we need to have a conversation with religious groups about. And this is a very sensitive issue. There was a time 80 years ago in Germany when you stood in a line, and when you got to the front of that line, you pulled down your pants. And if you were circumcised, you were shot in the head with a Luger. Okay? This is a very, very touchy and very emotional subject with many religious groups, especially Jewish people. This is a very, very focal and important covenant in their religion. And it needs to be touched with delicacy, but I also think with rigidity, because we have a very difficult mindset. There's a lot of very intelligent Jewish people who understand everything that I just told you about and say, well, I'm still circumcising my children. It's a very difficult mindset to deal with. And I'll give you 3 examples. In 2006, a rabbi passed on a case of herpes by doing mitzitza b'ba, which is the sucking ritual. After the circumcision, he sucks the blood out of the penis. He passed on herpes, and the child died. So the New York Health Authority put out a restraining order against that rabbi. The restraining order was not, you can't go near children, you can't cut children's genitals. The restraining order was, the next time you do that, you have to use a glass tube. So here's a man still with herpes that has to use a glass tube now, and he protested that decision. So this is the mindset that we have. In San Francisco, when the bill was proposed to ban circumcision, and there was the ACLU formed a coalition of Jewish and Muslim religious groups that opposed the bill, and they opposed it, saying the bill is socially unjust because it prevents a child from participating in an essential religious ritual. Like the child is participating in the ritual. Okay, so the child is being inflicted upon by the ritual. And the third example I'll give you is last September in 2011. There was 2 cases of non-fatal herpes this time from Moyle, a rabbi who was doing a circumcision. And he went before the same health authority, and he was basically reprimanded the same way. And his words were, he says, we cannot change. He says, we will not change. That was his response. And I would just end this talk by saying religions do change. There are lots of commands in the holy books that say to stone people who work on the Sabbath. They talk about slavery and treating women like cattle. There's all kinds of commands that are no longer considered morally acceptable. And this outfit that these Moyles are wearing right here, this is the Hasidic Jewish outfit. This is the dress of the 17th century Polish gentry. Okay, this is what the landowners in Poland in the 17th century wore. Okay, this has nothing whatsoever to do with Judaism 3,000 years ago. Religions change all the time. They change from social pressures from people like you that think about this ethically without the baggage of God told me to do it, inflicting everything. And this is, I'll just leave this quote from Voltaire. Sorry, Sean, I went a little long there.
All right.
It's all yours.
Does anyone have any questions they would like to ask or further discussion on the topic? Josh?
So going back to Finland, you said that in the populations where 0% of children are circumcised, there's still an instance, 1 in like 17,000 require circumcision for medical reasons until the age of 18. What's an example of a medical reason to get circumcised?
Paraphimosis would be the most common thing, where the foreskin it retracts and it can't be pulled back down. Okay, it can develop an infection. A lot of people think that number is too high though, because as physicians we're trained how to cut it off. We're not really trained how to care for intact penises very well, right? And one of the mistakes, urinary tract infections, they're so high because the health recommendations are to retract the foreskin vigorously in a young child and scrub the penis. And this is the worst thing you can do. You're supposed to leave it alone, right? You're never supposed to retract the foreskin. It retracts on its own. It's the male equivalent of the hymen. The membrane will separate sometime before 13 years of age. It's very variable, right? But the most common thing is an infection or paraphimosis, and it's very rare.
And there would be no way to determine beforehand whether or not that child would develop that infection?
Just like appendicitis, you have to take your chances, right?
Okay.
Like every Japanese citizen does.
And so, do you want to talk about regrowing your foreskin?
There is a movement of foreskin restoration where
Yeah.
where you saw that scar. That's still the most heavily laden area of nerves. So what the devices were actually invented by Jews living in the Hellenic times, and they were forbidden for going into Greek baths because they were circumcised. So they developed these weights that would sort of pull the skin over the shaft to pull it down over the glands. And if they wore the weights long enough, eventually it would stretch it back over and cover the glands. This was to participate in like Olympic Games, gymnasiums, public baths, that kind of thing. So the foreskin, TLC Tugger is one of the companies that makes one of these, but they're foreskin restoration devices. TLC Tugger. People that use them say that it improves the sensitivity of the actual glands, but you can't regrow all these nerves, right? The nerves are settled. But just covering the glands again, the keratinization actually softens up quite a bit.
But you wouldn't get back any of the mucosal membranes or anything like that?
Yeah, most of those corpuscular nerve receptors are gone.
Okay.
Yes?
When you spoke at the introduction about how you refused to do this operation during your medical school, what was the perception of
Very understanding, actually. This was a Jewish pediatrician, and there was never. Did you ever have an incidents like that?
Well, when I was going through, we had the issue that came up around the time when I was doing it was anesthetizing, using sort of numbing up the penis first, and a lot of it that came up as was one of these things to get around sort of pain around circumcision, because every kid went ballistic like this for a long time, right? It was kind of a tough thing to watch, and a lot of the doctors stopped doing it because it didn't make a difference. They went ballistic no matter what. So we all participated, and I had a difficult time doing it. I think we all did. Just because the kids were obviously in pain for a long period of time, even long afterwards, so days afterwards before they go, they'll be kind of whimpering and that sort of thing. But I sort of just avoided the whole thing. I just whenever it came time to do it, I had something else to do. So I didn't refuse, but just sort of wandered off. They let me go.
And another question, you spoke about the studies about the intactivists and circumcised doctors that performed studies in Kenya, and you said that they were skewed because, in Canada, where you said they were skewed, the doctors that were intact.
The recommendations.
Made recommendations based on that. Have we seen a trend at all on circumcised doctors move towards becoming more of an activist?
Yeah, I think so, because the rates, there's never been a year where the rate's gone back up in Canada, right? So we've just seen a steady, very slow decline over the years. And what's the doctors, the problem is it's not very many doctors that do it, right? There's one or two doctors that do basically all of the community circumcision. And I guarantee you that 100% of those doctors are themselves circumcised, right? But what's really the most important thing is to most parents is the trend in society. So when parents hear, well, right now it's more than 70% of children are left intact, right? It's about 75% of children are left intact. Then they say, well, little Billy in the locker room, I want to look up. I'm not doing that, right? So that is the most useful tool. Is well, this is the norm now, right? This is the norm, and this started every famous person, political figure, politician up until 1860 throughout the history of Europe was intact. Okay, there was a generation there at the end of the Victorian era where there were intact fathers with circumcising their children. So we've had this generation where the children are different than their fathers, and now we're seeing the flip side is that we have circumcised fathers who are leaving their children intact. Right, and I think that it's access to proper education is the biggest barrier, because the consent process is still quite poor in my opinion.
Last question?
For those here who have been persuaded, what can we do to participate in the intactivist movement?
I think, again, it's not a very easy topic to bring up at a cocktail party. It's not a very comfortable topic. I've had people
when, you know, at the beginning of my talk saying, who the hell are you to tell me how to raise my kids? I've had people get very angry about being challenged on this, right? So it's a difficult topic to have a broad conversation, but the target is the people who are having children, right? Making sure that they have access to proper information. And I think the other thing is constant. I write letters nonstop. None of them ever get published. Not very seldom. I write letters to newspapers. I write letters to McLean's. I write letters to everyone. I'm just one of those nutcases, right? But the more public discussion about it, the more people realize, you know what, this is nuts, right? So that's what the San Francisco ballot did. They tried to ban it in the city, and they knew it would get voted off, right? These people spent $180,000 on lawyers to take it off the ballot, right? They have a lot of money, these religious groups. But it got public awareness. It got Americans thinking about it, right? So little movements like that, little bylaws saying, you know what, like this shouldn't be performed in a hospital. I don't want my tax dollars paying for this, right? Those are where the first places to start are.
Is it currently covered as a medical procedure in Canada or in Ontario?
No.
Okay.
Not one province in Canada is it paid for. There's about 20 states left in the U.S. where it's actually paid by Medicaid, but most states in the U.S. it's not